We struggled with infertility for a few years, then ended up doing IVF, and we had Lucy, who's now 2. I had complications having her, had to have like an emergency C-section, bled just a lot during all of it because I pushed for like 5 hours prior to it. Turns out my bowel had perforated, blood had stopped flowing to a part of my bowel. So I had sepsis, my body was like in shock, and I was hospitalized for about 5 weeks while my daughter was a newborn. I had like many surgeries after for it, but the first surgery is where the heart issues came in initially. My heart rate would just keep going up, so they had to keep giving me these shots like over and over and over again. Like every time I would like start to drift off to sleep. And then finally they like got it stabilized. So life started to become like normal. You know, we did like normal fall things with a little baby. And then I felt a lump. They did a double mammogram just in case, like to check. And I found out that I had cancer in my left side and my right side, a separate cancer. And that was the day before I went to go get an echocardiogram and a stress test. That's when I found out that I had heart failure. I was diagnosed with breast cancer and I was diagnosed with heart failure, and everybody was like, what? Like, how is that even possible? I started the search for figuring out where I was gonna get treatment. So I was referred to VCU from my cardiologist to see Dr. Shukeen, so to see a cardio-oncology professional.
She was a new mom taking care of her kid, and all of a sudden she gets diagnosed with cancer. All of a sudden she gets diagnosed with this significant heart weakness.
With the cardio-oncology team, we looked at what medications we were going to give her, how cardiotoxic were they, how much would they affect her heart function.
And so the cancer team wanted to make sure that her heart was safe to receive the type of cancer treatment that they wanted to give her.
We really worked with the Pauley heart folks. She had already had a good established relationship with them, and we work with them quite frequently.
Which has been a game changer for patients like Sam, because they can have a cardiologist who knows their heart physiology, who knows the management of cardiac disorders, but they can view this with the filter of what's going on with their cancer, what is the therapy that they need for their cancer.
And we chose therapies that were not only going to make her heart stronger, but also help protect her heart to minimize any future risk while she was getting her cancer treatments.
We were able to offer her an alternative chemo regimen that had equal efficacy to what she would have otherwise received, and there was less cardiac implications in terms of toxicity.
So she was able to receive all the best cancer treatments to maximize her oncologic outcomes.
She did really well throughout her chemotherapy.
I had 20 treatments of chemo, and then I had a double mastectomy with reconstruction. And then following that, once I was kind of at the point where I could do radiation, I had 33 treatments of radiation, which is kind of a lot. They do a biopsy when they do the double mastectomy, and I had a complete pathologic response, so there was no cancer left in where they had biopsied.
She actually had very stable cardiac function during her treatment, but it was something that got monitored really carefully.
I had a repeat echocardiogram and an MRI a couple months after the fact, and my heart had already started to recover just from being on medication. And it protected my heart all through chemo and radiation and the surgeries too.
We are one of the best cardio-oncology programs in the country, and certainly in the East Coast. We've been doing this for a lot longer than a lot of the institutions.
And the way that they did it at VCU was so comprehensive, and especially with having to deal with the heart part of it, it was so nice to have it all in just like one system and one like a group of people that would actually communicate about me.
I think the biggest advantage of patients who get their care at VCU is the extensive collaboration that we offer.
It was really hard. It tested like every bit of fortitude that I had. I had to do it, you know, like I just had a baby. I wasn't gonna not go through the treatment to like give myself my best odds.
And she's doing great. Her heart function is, I think, back to essentially completely normal. You know, cancer is at bay. You know, I think she's enjoying life, enjoying her little one too.
It was like I had like a whole new lens for life, like truly a new lens.
She's able to take care of her kids. She's able to do all the things that she wants to do for the rest of her life.
It's become even more apparent, like how beautiful things are. It has amplified my life like tenfold.